Hello, and welcome to the Transform Wellness Clinic. I'm Dr. Bradford Perkins, and today I'm going to talk about my Transform Health program. So, the title of this is going to be Optimal Health Decoded, the Keys to Performance and Longevity. So, the conventional advice when someone sees a doctor and they're healthy overall, or maybe they're struggling with some symptoms, they'll go to their doctor, get some regular blood tests done, and they just are told, labs are normal. It's just part of getting older. Or keep taking your medications and follow a healthy diet. Some very generic recommendations. They might be told to exercise more, eat less, and manage your stress. Here's another prescription for sleep, anxiety, etc., whatever is going on. But that's not what people are looking for. We have people that are struggling with fatigue, brain fog, problem sleeping, tossing and turning in bed, struggling with their weight, or just poor work performance. There are people that are struggling with food cravings and struggling at home, interpersonal relationships with either spouses or children. That's the Transform Wellness difference. We're going to help clear up those symptoms that you're having. I'm Dr. Brad Perkins. Again, I'm here from San Jose. I've worked in Los Gatos since 2007. I founded Transform Wellness back in January of 23. I'm board certified in family medicine, board certified in obesity medicine, and I'm also a fellow in anti-aging medicine. The mission statement here at Transform Wellness is to provide personalized care that addresses the core drivers of health, enabling patients to optimize their health span and well-being through evidence-based solutions and sustainable lifestyle changes. So this is where my story comes in. I used to struggle a lot with my weight, and it's still a struggle with, the underlying causes at times. Here's me in residency, overstressed, poor sleep. The only thing that's good in this picture is I had hair. You can see that I was I was obese, wasn't sleeping, chronic stress. It just was a very hard time. But I was able to make those changes, and I became very active, and I was able to do multiple triathlons and stay very physically active through the years. I've done Spartan races, mud races, all those things are just really fun. But when it comes to a program, these are the common objections that I hear. I just don't have enough time. It's too expensive. I don't know where to start. I've tried before, it didn't work. I don't feel sick, so why should I change? I don't like to exercise. I'm too stressed to make changes right now. Well, each of those can be even considered an excuse. What are your priorities? What is your purpose? Where do you want to be in 20 to 30 years? Now is the time to start making those changes, because by investing in your health, it's investing in your future. So, the keys to success are going to be willingness to take action. You want to focus on progress, not perfection, where no one's perfect. We just want to focus on progress and commit to never let self-doubt stop you. You can do it. There's hundreds and thousands of people that have changed their life and gotten healthier as far as their underlying health that you can't see. So here is the Transform Performance Program. Why is the program here? Here's the problem. This is what people come and talk to me about. They might not have any of these symptoms, but these are the main ones. Chronic fatigue, brain fog, sleep problems, joint pains, digestive issues, weight management issues despite diet and exercise, or stress, anxiety, depression. The traditional top triggers or advice someone that is given is, I'll just eat less, move more. This is part of the normal aging process. This is part of perimenopause or menopause. Most likely it's not, and there are things that we can do to help you. Here are the actual triggers. It's the cells, it's your metabolism, that's your mitochondria. It can be a hormone balance, including cortisol, which is the hormone that's related to stress. It can be an unhealthy gut environment. We are learning so much how our gut microbiome affects our life, and just generalized inflammation. And in the program, we go through all of these. The top treatments to optimize your hormones, we're looking at your cortisol, insulin, thyroid. That's a hormone triangle that I look at, and also optimizing sex hormones if needed. Mitochondrial health, we're looking at toxins, chronic infections, nutritional deficiencies, and also make sure that there's enough movement in your day-to-day life. Inflammation can go to poor dietary choices, poor sleep, or an unhealthy gut environment. So in the traditional medicine system, you're looking at just treating symptoms. They'll just give you more prescription drugs. This is one size fits all. Everyone gets the same treatment. It's very reactive. But here in Transform Wellness, we really want to get into prevention, improve performance, get to the root cause of the issues. We focus on lifestyle changes and cellular healing. It's very personalized. Everyone's different. So it's going to be a different approach slightly for everybody. And it's a very proactive and holistic program. So the top lifestyle improvements one could make include nutrition, which is focusing on whole foods, fruits, and vegetables. Sleep is 7 to 8 hours of quality sleep. Sitting less, moving more, and just stress management in general. There are many supplements I like to use. There's a good multivitamin, an omega-3 is important. If we need to do cortisol support, we use adaptogens or B vitamins. If we're looking at insulin support, if someone's having high insulin levels, there's the list there. It's all included in those two supplements. B vitamins, vitamin D. If someone wants to go down the path of advanced longevity, when we're looking at things that are going to go beyond this program, that's really the next step. We have to get you ready to go to that next step. If someone's looking at things like mTOR and AMPK modifications, sirtuins, if you don't know what those means, that's okay. That would be part of the follow-up program. If you really wanted to go down that route of optimizing health. But this is going to focus on getting you to that spot. Here's a patient story. I saw this 25-year-old woman really struggled with anxiety, bad IBS, trouble losing weight, couldn't sleep. For her, we did a gut protocol. We found out she was sensitive to gluten, gave her some vitamins, and then within 3 months, her stomach issues went away, her anxiety went away, and she'd already lost 15 pounds. So we have to get to the root cause, what's blocking it. And if that's the gut, we heal the gut. If it's toxins, we do a detox protocol. Is it mold? We do a mold protocol. But we definitely go and help you figure out what it is so we treat it correctly. So are you ready to take control of your health? Is this something that you think is going to help you? Here are the 3 pillars of my program. You have Discover, that is testing. Transform, which is, supplements, is that specific things in lifestyle and nutrition. And then Thrive. How do you go from here? And then at that point, do you want to go into the further longevity pathway? We focus on metabolism, like you're having a well-run car. The mitochondria is the fuel, so are you getting the right fuel sources? And then inflammation, got to control inflammation. So inflammation's like rust; it breaks down the car. So in the Transform Performance program, we do a 60-minute consultation, 30-minute monthly follow-ups, 6-month curriculum. I do take insurance, so if you have PPO or Medicare, there's $500 off. We do body composition testing with a bioimpedance scale here in the office. We do in-depth testing. What's included in the program is comprehensive labs through Rupa Health. There's 2 sets of labs, including hormones. We will do hormone optimization for testosterone or for estrogen, if that is what's needed for women. We do vibrant wellness testing because I want to get an overall picture. We're going to do gut zoomer. That's a microbiome test, toxin burden, food sensitivity test, organic acids, kind of gives me an idea how your mitochondria are functioning, an oxidative stress panel that actually gives you an age, but it also tells me what we need to repair in your body. A Dutch test is included. That's a dried urine test for men and women. It tells me how you're detoxing your hormones. There's two different levels of the program. We can do a calcium score for your heart or clearly CT angiogram for your heart. For the Rupa labs, we're going to run a very in-depth set of labs you can see here that looks at your cardiovascular health and metabolic health. There are certain things we can add on to the program. There's further testing we can do, which is prenuvo full body MRIs if people are interested. There is a company called True Diagnostics. They have a bio age, and it gives you multiple biologic ages. You're only as young as your oldest age when it comes to that test. And we can also do some 3x4 genetics to really make sure we're optimizing your health. I am adding treatments to the office. This includes IV therapies from Myers or NAD+. NAD+ is a great way for people just to feel better. And we do offer certain peptides here in the office. We also have what I call my wellness suite, and that is a set of devices. These are all add-ons that can really help transform your body. One is the Emsculpt Neo. It's been out since about 2021. It helps burns fat and build muscle. It also will burn visceral fat. It's great for people that have chronic back pain. It now has indications to help rehab injuries, increase range of motion of joints. I also have a device called Emsculpt. It's been out since 2017, which helps rebuild and strengthen the pelvic floor muscles. So it helps with urinary incontinence. This helps with chronic back pain because the pelvic floor is part of our core muscles. It also can improve intimate wellness. I have the M-Face. M-Face is a device that helps strengthen the muscles of the face to help naturally lift the face as we get older. Those muscles weaken, so it's a way to help rebuild the face. And I do have a device called the Exion, and that helps with skin tightening. There is a microneedling for that, great for skin texture and acne scarring. And it can also treat areas of pocketed fat like in the bra area or on the legs. So here's my question to you. If we were having this discussion 3 years from today, and you're looking back over those 3 years, what has to have happened in your life, both personally and professionally, for you to feel happy with your progress? And that is really a question for you to think over. Another one is, what is your purpose? What is your personal purpose? Not your work purpose, but what is your life's purpose? Where do you want to be in 20, 30 years? These are questions to ask yourself to see if this program is right for you. So if you want to help transform your life now, this program is a great way to start so that you can be healthier and improve your health span so that when you're 75, 80 years old, you're still able to be active and not feel sore, not have diabetes, not have had 3 strokes. This is a great place to start. So you have 2 choices: continue on the same path you have, or dive into this program that can be very transformative for you. So now is the time. Now is the time to make that difference. Time to get moving. Go for the goal and change your life. Get out there and be able to be with your friends. Be active. Schedule now. This is the time. Call my office. I'd love to meet you all and help you transform your life and your health. And if you have any questions, give the office a call, and we'd be happy to help you. Have a nice day.